everybody, my name is Teresa Smith. I'm a physical therapist with Court downtown, and I specialize in pelvic health, and that's what we're here to talk about today, pelvic pain and pelvic incontinence. And so I have behind the camera questions, and we'll get started.
Okay, what is pelvic floor?
So the pelvic floor is just a group of muscles that sits at the bottom of the pelvis. So it almost acts like a hammock to kind of help support those organs. So in females, the uterus and the bladder and the ovaries and the rectum, it kind of just helps to support those. It also works to squeeze around the openings so that your urine and stool can stay inside your body until you're ready for it to come out. It also relaxes so that you can have intercourse or penetration of any kind.
How do I know if I need pelvic floor physical therapy?
So pelvic floor dysfunction looks a lot of different ways. So it can be urinary leakage or stool leakage. It can be pain with sex or constipation or urinary urgency, so feeling like you have to go to the bathroom right now, or increased frequency, so maybe going to the bathroom more than 7 times a day. So it can look a lot different. Even sometimes people with hip or low back pain have some pelvic floor dysfunction and may not realize that it's related to their pelvic floor dysfunction.
So what is the difference between stress and urge incontinence?
So those are 2 different types of incontinence. So stress incontinence is typically what happens when you leak urine with coughing, laughing, or sneezing, or maybe exercising, doing jumps or high impact activities. You may leak some urine in that way. Urge incontinence is more like when your bladder is really full and you have to go to the bathroom really badly, and you're on your way to the bathroom and then you leak some urine or stool.
So if you've never had a baby, why would you have pelvic pain?
Mm-hmm. So pelvic pain does not discriminate. It can literally happen to anyone. So it might be related to a fall that you had on your tailbone years and years ago. It could be related to some lower back pain too. It could be related to having a different partner or maybe a history of abuse or trauma as a child.
You mentioned having a partner. Is it normal to have pain with sex after having a baby?
So typically after you have a baby, the first time or 2 might be painful, and I would say that's pretty typical, especially depending on if you had a vaginal birth, if you had any tearing, if you had difficulty healing after delivery. That's pretty common, but that should go away. And so if you're still, a month or 2 months later, you're still having discomfort, or maybe even sooner than that, that's something that you should see a physical therapist who specializes in pelvic health.
Why do I have pelvic pain when I run or exercise?
So a lot of people have this. So the feeling of heaviness or pressure, or some people even say that they have the feeling of falling out, and that's often a sign of pelvic organ prolapse, where those organs have sort of dropped and they're not being as well supported by those pelvic floor muscles. And a lot of women have this after childbirth, and they don't realize that they have it. That it's typically managed conservatively, so with physical therapy and exercises, and to help to kind of to strengthen those muscles.
We have a question that came in. I am 80 years old. Is there anything you can do for my leaking at my age?
Absolutely. It is never too late to start. We very typically have people in their 80s or even some in their 90s who have been helped by pelvic floor physical therapy. So sometimes it's a matter of strengthening. And so, as we age, we tend to lose some of our strength in our muscles in general, and that's true of the pelvic floor as well. Sometimes it's a matter of, undoing some bladder habits that you might have. So maybe going to the bathroom too often for things, or having a lot of bladder irritants in your diet, and that can affect things too. So it can be helpful for people at any age.
So tell me, what does a typical session look like and what can I expect on my first visit?
So on your first visit, we'll ask a lot of questions and then we'll do a lot of listening. So we want to know what triggers your symptoms. We want to know what helps it, what makes it better. And then we can kind of design an individualized plan for you. So that might look like evaluating if you have back pain, and so checking the range of motion and strength of your trunk muscles, and then it may include an internal evaluation of those pelvic floor muscles as well.
How long should it take me to get better? What can I expect as far as how long I'll be in treatment?
So a lot of times, people say that they're 50% better after the first visit, and that's pretty exciting. So some people, they just need to change some of the things that they're drinking or eating, and that makes a huge difference for their urinary urgency or frequency, to take away some of those bladder irritants. But I would say that typically people are in treatment for maybe 6 to 8 sessions or something like that. Sometimes people get better a little faster and other people take a little longer.
You mentioned an internal exam. Do I have to have that?
So an internal evaluation of the pelvic floor muscles involves intravaginal palpation of those muscles. So we want to check the tone of those muscles. We want to check the coordination. And we want to check for any tenderness, because that can help us to decide what best will help you. There are a lot of people who are not comfortable with that, and that's okay. So that's not something that we have to do. And we can also delay it until you feel ready for it. And if you never feel ready for it, that's okay too. There's still a lot of things that we can do without that.
I have IC, and what can pelvic floor physical therapy do for me?
So IC is interstitial cystitis, and that's a painful bladder syndrome. So a lot of times this can be related to diet or bladder irritants as well, but oftentimes with chronic pelvic pain of any kind, there is a muscular component to it. And so oftentimes it's really helpful for people to relax their muscles to be able to manage their pain, and teaching people stretches and different tools that they can do to help their pain can be really helpful for that, empowering them to manage that syndrome on their own.
So we have another question that came in. I've been doing Kegels and still leak. What can PT do for me?
So that's a really common question. And research has shown that oftentimes at least 50% of people are doing Kegels incorrectly. So my first question would be, are you doing them correctly? My second question would be, is that really what you need? Oftentimes with pelvic pain, people don't really need to be doing Kegels. And so Kegels will help to strengthen and help to support those muscles, but sometimes what they need is to relax. And so that's kind of the opposite of what they would need. So it's really important, if you've tried some of these home things and you're not getting better, it's really important to be evaluated by a pelvic health physical therapist so that you know that you're doing the right treatment for you.
So how much does it cost to do pelvic floor physical therapy, and does insurance usually cover that?
So most of the time, insurance covers pelvic health physical therapy, and the cost varies widely based on whether or not you have met your deductible, which, oftentimes if you've had a baby, you've probably met that deductible for the year. And then it varies based on your co-insurance or your copay, things like that. So, but typically it is covered by insurance.
So how do I make an appointment?
So you can call a centralized number. So it's 1-800-645-KORT. And you can also go online to court.com and get set up with an appointment.